Hi, I'm Lindsay Maybranch, and I'm going to talk to you about obstructive shock. What is obstructive shock? Obstructive shock is a form of shock associated with physical obstruction of the great vessels or the heart itself. Pulmonary embolism and cardiac tamponade are considered two forms of obstructive shock. The pictures with the lungs shows a pulmonary embolism in the vasculature of the lungs, and this picture over here shows a cardiac tamponade, which is a buildup of blood or other fluids in the pericardial sac that puts pressure on the heart, which prevents it from pumping efficiently. Patient assessment for obstructive shock: signs and symptoms: dyspnea, tachycardia, tachypnea, cold and clammy extremities, hypoperfusion, elevated jugular venous pressure, pulsus paradoxus, chest pain or chest pressure, decreased urinary output, confusion, dysphoria, weak pulse, excessive sweating, and rapid shallow breathings. Hemodynamic monitoring and findings. The hemodynamics of obstructive shock are monitored by Swan-Ganz catheter. The hemodynamic findings are systemic vascular resistance is increased, the cardiac output is decreased, the central venous pressure is increased, and pulmonary artery wedge pressure is increased. Mixed venous oxygenation saturation is decreased. Pharmacological treatment for obstructive shock, or cardiac tamponade, is a medical emergency that requires urgent drainage of the pericardial fluid, administration of oxygen to the patient, volume expansion with blood plasma, dextran, and or isotonic sodium chloride solution as necessary to maintain adequate intravascular volume, and bed rest with the legs elevated. This helps to increase the venous return. Arterial blood gas and mechanical ventilation. Arterial blood gas for a patient with obstructive shock are a respiratory alkalosis with hypocapnia and hypoxia. Positive pressure mechanical ventilation should not be used because it can decrease the venous return and aggravate a cardiac tamponade. Thank you for watching.